Okay. Beautiful. And yeah, feel free to take it away whenever you'd like. I'm not, if it doesn't allow you to share your screen, I can, or
It's not turned on.
I made you a host. So there you go.
Thank you. All right. All right. Can you all see that okay? There we go.
Yeah, I can
Now we're
see it.
cooking. Okay,
Yeah. If
awesome.
y'all
Thank
have
you.
questions, I'll try my best to monitor the chat,
Thank
um,
you.
forward in your way. Thanks.
Yeah. Well, and I like to always start this and just say, if you have questions as we go along, do not wait. Just feel free to, we're a pretty small group, feel free to come off mute and just like, hey, actually, can we pause right here? Um, and just ask your question as we go along. Um, so I've let me start off. Hi, everyone. I'm Priscilla Easterling. I'm the Director of Outreach and Enrollment for Kentucky Voices for Health. I'm also a connector, which means that I help people apply and enroll in public benefits like Medicaid and SNAP, and I also do marketplace enrollment as well, all through the KYnect integrated eligibility system. So today we're going to do a just like introduction and walk through all of the different pieces of KYnect and being a connector. If you have, I'm going to go through a bunch of the programs that are on KYnect. But again, if you have questions about anything about KYnect, about being a connector, about any of this, please just stop and ask me. I'm not guaranteeing that I know the answer. I know a lot of answers, but I'm not guaranteeing that I know them. If I don't, I can always connect you to the right person or find that information out and get you an answer. So as a connector, we're actually required to make as many connecting puns as we possibly can. And so that brings us to our title, Connecting to Public Benefits, because our KYnect integrated system is fantastic. Um, so let's jump in. Assuming, there we go. So first, when we talk about KYnect, for what is KYnect, and it really is just a one-stop shop for a range of benefits that are available, assistance programs, health coverage, other benefits and resources that are available all within KYnect. And it's that very simple, connect.ky.gov. KYnect has been around since 2013. I remember I had just graduated Berea, and instead of staying in Kentucky, I went home to Virginia and I had to work, and I got a job as a navigator, which is the federal word for a connector. And I had to use stupid healthcare.gov. And the first 3 years of that job, all I heard the entire time was how incredible Kentucky's state-based marketplace was and how wonderful the Connect system was. And so I spent the first 3 years doing application assistance, just wildly jealous. Like, why didn't I stay in Kentucky? And so now I'm glad to be back and able to work with that. So it really is, it brings all of those programs and resources all into one space, making it easier for folks to just to apply for all of the benefits that they might need and at one time. So again, we cover health coverage, benefits. They really separate them out on the application. So when they're talking about health coverage, that's going to be those qualified health plans. That's we also call those marketplace plans. That's where premium tax credits and cost sharing reductions and stuff like that is going to be um, contained part. That's all part of that. For benefits, they look at that as any of those public assistance benefits. So SNAP, Medicaid, child care assistance, and KTAP. So I like to say SNAP, CCAP, and KTAP because I love to rhyme. And then there's also the Connect resources, which they're in the process of really developing out more broadly, and we'll go into that a little bit later. But it helps folks find resources with all of the other safety net issues that they might need help with. Housing, employment, finances, mental health, referrals, transportation, community resources for food, so food pantries, things like that. Those are all going to be found, legal aid, they're all going to be found in KynectResources. Resources. And so and now there is a social determinants of health assessment that is baked into both the application on KynectResources and that populates within KynectResources resources so that you can see, this person took this assessment, where are the areas of greatest concern, of greatest need, and then you can individually make referrals for each of those areas. So again, that one-stop shop. A little bit more. Here's all the programs. This is really what it looks like on the website. Yes. So when we talk about Medicaid, because I love to get into Medicaid first, Medicaid is a phenomenal joint partnership program between the state and the federal government that provides health coverage for low-income residents. Now, really, most people will be covered by Medicaid at some point in their life. In Kentucky, over 50% of all births are covered by Medicaid and have been for the last 20 to 30 years. I want to say that number, it crossed over that 50% threshold around 1997. And so it is an incredible program that covers a lot. And it also covers about 70% of nursing home stays. So it's a cradle to grave safety net program for Kentuckians and comprehensive benefits. There are no co-pays, no co-insurance, and so it's a completely free program for members so that they're able to go to the doctor and seek any healthcare services that they might need so that they can live a healthier life. We love Medicaid at KVH, and we might see some swag coming out next year that specifically says, I heart Medicaid. So we're excited about that. But Medicaid is just really such a foundational program that helps make sure that folks who can't otherwise afford to get to the doctor are able to. So the income guidelines for Medicaid are a little different. I separated them out here, but really the big picture is that for our Medicaid and our K-CHIP programs are so integrated in KynectResources that for anyone who's doing the application, they won't really know the difference. They'll just get a determination that says you're either eligible for Medicaid or you're eligible for marketplace coverage. But for Medicaid, here's the guidelines for most adults with that income guideline is 138% of the federal poverty line. While the actual number of what 138% of the federal poverty line looks like, that income number changes from year to year. That 138% is just what the actual guideline is. And so as those federal poverty lines are released, 2024 is higher than 2023, 2025 is higher than 2024. There's always a slight adjustment that moves that income a little bit higher. So if you're working with clients from year to year, if you remember in 2024 that the threshold is going to be like $19,954, when you cross the year, you want to make sure that you're going back and remembering a new number because all of those numbers do shift from year to year. For K-CHIP, they cover incomes at a slightly higher percentage, but for overall, K-CHIP is for children and pregnant people with countable income up to 218% of the federal poverty line. So adults up to 138%, they can get Medicaid, no problem, no issues. But outside, otherwise, adults would be eligible for marketplace coverage. But for children and pregnant people, they identify those as special populations. They can be eligible and still be covered under K-CHIP up to 218%. So here is what the 2025 Federal Poverty Alliance look like. Now, this is all of the things in one. So we're looking at both Medicaid eligibility and then also the qualified health plan eligibility. And I'm going to send, I've already shared these slides. I'm happy for those to go out to everyone if you would just like to have them. So there are additional savings that are available in the marketplace side of things. And so just reiterating, at 138%, up to 138%, everyone is eligible for Medicaid in Kentucky. We with some exceptions, but folks are generally eligible for Medicaid. We have Medicaid expansion. And then once you get above 138%, we're looking at marketplace coverage. Now, there are still some savings that are available through marketplace coverage, that premium tax credits that goes directly to the monthly premiums. There are, I want to say the last number that we looked at was 1 in 5 can get a marketplace plan with premium tax credits for less than $10 a month on average. So it can still be very affordable. But as you move into those higher income brackets, 250% and above, the cost sharing reduction, that kind of goes away. And then the premium tax credit lowers as your income gets higher. So if you're at 150% right now, the cost for a silver plan would be $0 a month. But if you're at 300 or 400% of the federal poverty line, you might be eligible for some premium tax credit, but not as much as someone who's at 150%. So very sliding scale. And at the bottom, you'll see that percentage. There are caps still. The upside of marketplace coverage versus just going through a commercial insurer is that there are still caps on the amount that the marketplace says that you should pay towards your monthly premium. So at 150%, they say the max is 2%, but at 400%, it's 8.5%. So, the difference between making 22,000 versus making 60,000, they do very much take that into account. So let's move on. The other big program that connectors primarily help folks apply for is going to be SNAP. That's the Supplemental Nutrition Assistance Program, and it really helps low-income people buy food for healthy meals at participating stores. There's also the Double Dollars program, where if you go to a farmer's market, you're able, or some other designated community stores that are connected to the Farm Alliance and things like that, you're able to double your dollars, double your SNAP dollars buying power. So if you get $200 and you go to the farmer's market, you're able to stretch that and get $2 for every dollar just by, again, and trying to encourage folks to shop local and get healthy meals and stuff from their local community, from farms, from farmers, all of that. So that income sort of changes a little bit, but average is depending on your category and depending on their household size, but the average is 130% of the federal poverty line. SNAP does do a check for resources and cash accounts. Medicaid does not do that. Medicaid expansion specifically does not do that, and neither does Marketplace. But for SNAP, they do look at what is in your savings account. You do have to report that. And starting last September, now the work requirements, they were suspended during the pandemic, but as of September last year, 2023, the work requirements the work requirements went back into effect. And so anyone in the household who's 18 to 59 and can register has to look for and accept work. There are some exceptions that we'll get into in just a second, but this is, yeah. There are some county exceptions as well, but getting into some of what those exceptions look like, people experiencing homelessness, people aging out of foster care, and veterans, they can apply for an exemption. That's also done through the application. And then for SNAP, there is the second piece of doing an interview with DCBS, and that's something that they can also report at that time. Um, if you if for any of these folks who if for anyone who's experiencing one of these three exemptions, they're able to still receive SNAP benefits without having to report your active work activities. Other existing exemptions, if you're under 18 or over 54, currently pregnant, there's a list of exempted counties. I have this example of a really helpful explainer that we put together that our Thrive Coalition put together on the SNAP exemptions and the work requirements. And so there is a handy, this is also hyperlinked here. So if you click it when you get the slides, you'll also get this helpful explainer. Um, there are a bunch of exempted counties if you are physically or mentally unable to work. And a reminder, ABOD, they use that, we call it the ABOD requirements. It's the able-bodied, wow, able-bodied, as soon as I tried to say it, it just fell immediately out of my brain. Working and I can't figure it out. So I'm gonna skip it. Wow, it's gonna pop right back into my head in 5 minutes, and I'm just like, ah. But wow, I'm so upset that I see it, I can't reach for it. Okay. So if you're caring for an incapacitated person, substance use treatment, if you're in school at least half time or receiving SSI, these are all exemptions from having to report these work requirements, and still will make sure it will still allow folks to be able to receive SNAP benefits. And so when we talk about anti-hunger and food programs, there's SNAP that's on KYnect, but just announced 2 weeks ago, actually, the first of the month, WIC will be integrated into KYnect in 2025. So folks will also be able to apply for WIC through KYnect in 2025. I always include just like the National School Lunch Program and Summer EBT. Those are also wildly helpful programs. The Summer EBT you do apply for over through KYnect. There is a link on KYnect for that. The National School Lunch is through its schools. But very exciting news about WIC being included. And in case you did not know, WIC is not just for women. Men can be eligible. It says caretaker of children under 6, and that's often grandparents, that's often men. And so WIC is one of those wildly underutilized programs because the application process right now is pretty complicated and hard to find. But we're hoping that with it being integrated into KYnect, that one, utilization will go up, more people who are eligible will apply for it. And again, just making things that simpler and easier in that one-stop shop model. So how do you apply? Now, this is partially just like half the questions that I get as a connector are really just not even about the application so much as it is about how do I get there? What do I do right now? Because it is a much more complicated process at this point than it should be. Now, there's good news there. This process is going to be obsolete in probably 6 months. They are changing the COG login process, but right now, this is what it looks like. You first, in order to do an application, you have to create a COG account, and COG is the Kentucky Online Gateway. It's the state system where they have all of the like state programs that you can manage all in one place. And so you create a COG account, and then from COG you can log into KYnect. And from there, that's where you can start an application. It's absurdly complicated. A lot of people get locked out just with creating the COG account. Genuinely, that I get a solid 30% of my calls are just about this part right here, because COG is it's weirdly complicated. When you create that account and you get into KYnect, you do the
Okay.
application. One of the
Pause. There's some audio. I think Ashley and Whitney, your mics are on. I would turn them off myself, but I can't figure out how. I'm sorry. Love you all. Continue, Priscilla. It's okay.
Um, so when he gets the application, one of the first things it does is it's ID proofing. And so you put in your full legal name, your date of birth, gender, social security number, and it does what's called knowledge-based questions. And so it pulls up based on your credit history. Here are some questions. Did you ever have a car loan in 20, or did you ever have a car loan? And if so, who was the lender? And name of a road that you previously resided on. And that's going to be really based on a road that you either receive, an address that you either received a paycheck that was mailed to you and addressed to you on that road, or a page or an IRS, a previous address that you listed on your tax return. That's where they pull that from. We often hear people have problems with this. Did you ever have a credit card? Did you ever have a mortgage? It's all credit based. And there are a lot of people who don't have a sufficient credit history to actually pass the ID proofing. This is another pain point that we hear a lot, that prevents people from moving forward. What they do in the application is, if you're unable to answer those questions, it'll pop up with a reference number and tell you to call Experian. I'll tell you right now, if Experian pulls the exact same information. So if that ever happens, the easiest thing to do is to immediately call either a connector or DCBS. Because Experian, when you call them, they're going to pull exactly another set of knowledge-based, credit-based questions. And usually if people could not answer the first set, they're unable to answer the second set. And so it's almost a pointless call. And Experian they can't manually move through anything. They can't manually approve you. So they just tell you to call DCBS. They'll tell you to call the call center. It'll take a while to get through the call center, but I'm telling you, as soon as you get that, like, we can't verify your identity, call a connector. A connector can help, or call DCBS. So just a little shortcut. When you get into the case, you can manage all your benefits in KYnect as well. So you can see, what people are enrolled in. There's a case summary. All of the notices go into that message center. So there's a copy of notices that is mailed to folks, but then they also put them in their online portal. So that's an additional way to find that. If you want to find a connector, if you want to be a connector, all of that, the connector is also listed in that reps, connectors, agents section. And it's really just like a dashboard that displays all of the relevant information. You can apply for benefits. And then when you're doing that program selection, that's weirdly faded. When you're looking at like healthcare programs specifically, it is always going to double click. If you select Medicaid, it will automatically select QHP and Medicaid dental insurance plans without payment assistance as well. That's not an error. You can't deselect it. It is that technically every person asterisk, because there are always exceptions to this rule, just about every person is eligible to buy a full price QHP plan. And so they automatically run that eligibility at the time of application. You do not ever, you almost never want to only select QHP because you can do that and it won't apply for Medicaid. But if you do select Medicaid, it's dumb. But you want to make sure that you select the right program, select the one that has Medicaid. It is kind of confusing because of the way that they have it set up. The one program that I do want to tell you that there are 400 people in the state who are eligible for it, and that's KIHIP health. And it's we have a lot of people who accidentally apply for it because it says health insurance premium payments. And people think, oh, that's that premium tax credit, right? Like that's the marketplace coverage. It is not. It is a separate program. And once you do the application for that, it can get you like trapped in a very weird back and forth with DCBS. Um, there is almost no reason to ever select that unless you know someone very specifically who is eligible for KIHIP. Otherwise, don't select it. It will just cause a headache in the application process. So all of the documents, you can upload documents in KYnect. It will show you when you've uploaded them, and it'll show you the status, red, yellow, yellow half circle, if something is still needed, or if something has been submitted but hasn't been reviewed yet. Um, yes, sorry. I just saw the chat and I'm gonna come to that in just 1 minute. Okay. So yeah, all you can upload documents here and make sure and you're able to track them. We've also heard a lot of problems with people uploading documents here and them disappearing. So what I always recommend, one, take a screenshot when you upload it, just for a record for yourself. So you're like, I know I did this, and then just keep a copy until you know that stuff has been approved, because you don't want to, sometimes it's really difficult for clients to find the documents that they need. And then when you upload them and give them back to them, those documents can get lost very quickly and very easily. And if for some reason those documents disappear from the calls from KYnect, or if it's not sufficient or whatever, it's just much easier to be able to quickly upload it again. I love KYnect, but there are definitely pain points and areas that it can be improved on. So just also peppering in some tips and tricks as I go along as well. So just make sure to keep a copy until you know that that case has been like finalized and a decision has been made and the client has been enrolled in coverage or in their program. And then if any issues come up or anything changes and you need to report a change, there's a really just report a change button at the top. It'll give you some options for what you want to report a change about. But yeah, report a change. You want to make sure to report a change for any of the following stuff. Contact information, relationship, filing status, if you get other health care coverage, pregnancy,
I don't
education.
want to, thing.
Is that Michael, maybe? Do you have a question or you're unmuted?
Someone's mic is on, y'all. Make sure your mic's muted if you don't have a question.
And if you do have a question, totally cool to come off mute. Just
Yeah.
a reminder. Okay, so income, citizenship. For income, you do have to report changes to it, but the guideline is within like 5 to 10%. So if a person gets a raise or they're working overtime, it's a one-time overtime, one-time bonus, things like that. You do still have to report it, but you can use a little bit of discretion, because you don't have to report every dollar change if it's still going to be within 5 to 10% of what the original income listed on the application is going to be. But that's also, you want to be careful and like really have a conversation with the client, because, you know, are they working hourly and they're working seasonally, and while their income for this next 3 months is going to be much higher than usual, then it's going to drop back off and they're not going to have anything for 3 months. And so you can choose to report income either monthly or annually. Medicaid looks at it monthly. Marketplace looks at it annually. SNAP looks at it monthly. You just want to make sure that you're being both honest, but that you're reporting information in a way that benefits the client. Like, still honest. We're not lying. We're not hiding income, but you know, make sure that you're doing all of the math and making sure that you're deducting all of the deductions, because there are lots of deductions that are also available in here too. So just want to make sure that you're following the letter of the regulations and guidelines, but you can also make sure you're doing things you're reporting it and being smart for your client. Okay, and then if you need more help, there are connectors, there are agents available. Agents can do Medicaid applications now. They get paid. They get paid to do Medicaid applications. I think it's directly from the state, $50 an application. But it's free for clients. Connectors are also free for clients, and there are connectors available in all 120 counties. And they can really walk through that entire application, from doing that background education, like conversation and setup. What are your healthcare needs? What are you looking for? Let's talk about your income, all of that. And then explaining the programs, to doing the application, uploading documents, and then doing that enrollment, and then updating any information along the way that might come up. So I get a random texts, random times, like, oh, my income changed. And then as their connector, I just go in and report that change for them. So speaking of connectors, so I assume most folks know what connectors are, but the connector program, it really is like a collaboration between the Commonwealth of Kentucky, the Cabinet for Health and Family Services, houses the Kentucky Health Benefit Exchange, and they are the folks who are over the Connect program, the Connector program, and the Connect system more broadly. And so the primary goal of the Connector program is to help do those outreach, education, and enrollment, and application assistance. And so connectors are available to do that all over the state. So there are two different types of connectors. We're not going to spend a whole bunch of time on this, but there are 3 agencies that are contracted by the state to actually do application assistance, and but the big difference is that they're required to hold outreach, education, and enrollment events. Those 3 agencies we'll get into. They have to hold these outreach and education enrollment events. Everyone else is going to be a non-contracted connector, and they're all the folks who are at hospitals, federally qualified health centers, nonprofits like myself, health coverage providers, and just other agencies that provide any social services. They're all trained by KHBE. They all still have to go through the same certification process. The only difference is that contracted connectors also are required to hold outreach, education, and enrollment events. And so if you ever see them out in the community, or if you're hosting an event and you want to invite connectors, contracted connectors are really a great group to partner with, because they would love to do that because it's part of their job. Not saying that other connectors don't, but that is definitely a key focus there. So the 3 agencies, Community Action Kentucky, is in this blue. They cover so much of the state. The KIPTA, which is Kentuckiana Regional Planning and Development Agency, they're really centered around the Louisville and surrounding counties area. And then KPCA, which is Kentucky Primary Care Association. This map is actually a little out of date thinking about KPCA because they have expanded. And so now KPCA has connectors at every state university. They are expanding to every state university. They are at all KCTCS locations. And now they are expanding into several local DCBS offices. Right now, they are centered in the DCBS offices in Louisville, but they're going to be expanding to 4 to 8 additional DCBS offices around the state. So they're definitely expanding, but just making sure that connectors are available to folks where they are.
So are they at different like BCTC branches and locations?
Yeah, they are.
Cool.
Yeah, and I can, after they just shared a map of their full location, so I can share that with y'all
Yes,
as well.
please. Thank you.
Yeah. Yeah, absolutely. And so as they can, connectors can help find health coverage, help do that enrollment process, and then also do referrals for other resources. Not all connectors do all programs. Some do health only, some do food only, and some do both. And so but overall connectors can help with Medicaid, qualified health plans, that marketplace coverage, and then SNAP, CCAP, and KTAP. And then again, WIC is being integrated next year, and they expect connectors to be able to start helping with WIC applications at the end of 2025, maybe the last quarter or into the first quarter of 2026. So not quite yet, but it will be soon, and that will be great. They can also help report changes in information, do those renewals, and they, again, a free resource in all 120 counties, and you can search for connectors by county, and there are additional. Okay, because I wanted to, yes. There are some additional filters as well. So I, of course, live in Frankfurt. And so I did a little search for my computer is having a mind of its own. Sorry. Okay, stop. Who are the connectors in the area? And this is it. There's one, the map result. So if you want to just look for somebody in an area based on the map, you can do that. But then they also list them out. Carol she's the executive director for Kentucky Primary Care Association that I just talked about. She's great. You can sort by, there's also a language filter. So if you need someone who speaks Spanish or a different language, that they're also in there. And then you can also filter by programs you need assistance with. So if you're looking for someone who can do Medicaid or you're looking for someone who can do SNAP, you can filter that way. And then the availability, most people don't really fill that out, but some do, like Carol, before 9 a.m. or 9 to 5. But there are also some who do after 5 p.m. as well. So you can also filter that way. And then the qualifications one is the weird one, but it's public connector or facility-based connectors. Facility-based connectors really only assist clients that are related to their facility. So if we're looking at a federally qualified health center, the person has to be a patient of that federally qualified health center to be able to work with that connector. But there are still public connectors all over the state. Okay. If you want to become a connector or if you know folks who are interested in doing that, here there is an application here. Generally, this part is for new orgs that want to become connectors. If your organization has not already been deemed a deemed a designated organization by KHBE, here are some of the organizations that they look to approve. It's pretty broad, but really centered on community health centers and nonprofits because they will there are a lot of nonprofits in the state that have a connector designated on their staff. And then the training, so the organization has to be approved by KHBE to be a connector agency before you can even do the training. But then when you get into the training, you have to do it every fall before open enrollment. The initial training, I say, is about 20 hours of content. You can do that at any point during the year. 20 hours is rough, just depending on how familiar you are with any health insurance stuff at all. If you know what a deductible is, you are already ahead of some of the people who are starting this training. So it'll go over all of everything about KYnect and health insurance more broadly, plus all of the programs that are listed on KYnect, and then walk through some walk through some screens so that you can navigate the system. Once you do that initial onboarding, that initial training, then you still have to do a recertification before every open enrollment, but that one is closer to 4 or 5 hours every fall. Not too bad. And if you're interested, there's also this complete the application. And then as a staff, KVH, we have right now 1 trained connector. We had 3. 2 are gone, so it's just me, and I'm currently not accepting new clients. But we are trying to expand our connector program because we do really enjoy doing that assistance, but it's always been a bandwidth issue. And so we're going to be working with a limited group to get trained under our organization so that their organization doesn't have to worry about going and getting approved through KHBE. We're already approved, and then we just develop that partnership so folks can train under us, which very exciting. And if you're interested or know anyone who would be interested, definitely have them reach out to me. So, okay, in the last couple minutes, let's get into KYnect resources. And then I'll save just a couple minutes for conversation. So KYnect resources, I'm going to breeze through this piece. We've already talked about a lot of it. KYnect resources helps residents browse for community programs and services that are available. And again, that's like food insecurity, housing, legal aid, employment assistance, financial assistance, heating. All of those resources are listed within KYnect. And I've linked to the KYnect resources presentation. It is a full like 40 slides, maybe 30 to 40 slides of all of the A to Z on KYnect resources, and includes like how to get onboarded into KYnect resources. So I've linked that there, and I'm just sharing some of the highlights and some of the like important things to know. So it is a directory of programs, services, and supports throughout the Commonwealth. They're currently partnering with United Way to help close their to help close and support the referral process. And so the whole point of it was to bring together community partners and organizations throughout the Commonwealth into that single one-stop shop. Again, like single platform where folks can just look for all of these resources in a single platform. And that's to help reduce barriers to finding help, make it faster and easier to find available resources, be able to track what resources you've reached out to all in one space. There's now that closed loop referral system. So if when a client asks for a referral or a connector makes a referral to an organization, the organization is sent that person's contact information and the organization makes contact with the consumer. If they're unable to reach them, United Way has referral specialists who then are able to go back and work with the initial connector to try and make contact again, or to try and work with the consumer to find a way to close that referral. Sometimes there are various reasons why people don't answer. It's usually a phone call. Like some people don't answer numbers that they don't know. You know, there's lots of reasons why these referrals don't close. But if it's, you know, the organization never reached out, United Way now has that sort of backstop where they can follow up with the organization like, hey, you have this pending referral, so and so is waiting for help, let's connect you guys and get this together. So they really make sure that they're going through and closing that loop. Now, like I mentioned, there's that social determinants of health assessment that's included on the application, on the KYnect application, and in KYnect resources. So it can help one, it does a color coding system for all of those different measures, all of those different areas of potential concern, all of those social determinants of health, and it does red, yellow, green. Red, like in crisis; yellow, need support; green, don't need support. So it helps color code things and just make it easier for folks who are doing that assistance to figure out what referrals they need to look for as well. And then there's also that incentive initiative for nonprofits, where for every incentive that, for every referral that they close, and that's whether or not they're actually able to provide the service. So sometimes an organization gets reached out to for something that they don't do. They still, if they make that contact, make a referral elsewhere. If they contact that person who reached out for a referral, there's a $10 per referral incentive initiative. Okay. So this is the referral process. We just sort of talked through that, but this is it sort of laid out step by step. And again, like here's that red, yellow, green. I talked a little too fast, so I should have just waited. So red for in crisis, yellow for vulnerable, green for stable. And as far as we just asked this because last time I did a presentation, someone brought up like, can the client see if it's red, yellow, or red? I mean, red, yellow, or green, because for some folks, just seeing that like red next to something might be enough to like cause anxiety, cause them to be upset, and from what we heard, they can't see it unless they specifically open up the assessment and like look at their results. So they still have the ability to see the results of their assessment, but it doesn't automatically pop up on their page as like, here's your color coded assessment of where you're at in your life. Because that was some feedback that they had received. So this is, there are currently 6,700 organizations that are listed within KYnect Resources. This is about 6 weeks out of date, so it's closer to 7,100 right now. The state and United Way have done a lot of work working with community organizations, trying to get them onboarded, because truly KYnect Resources is only ever going to be as good as the information that's fed into it. So the more people, the more organizations that onboard into it and list their services as available, the better KYnect Resources will be. Some of the feedback that we had heard was that the resources weren't local enough, that like, yes, they were looking for, say, transportation, but they were that it broadened their circle to like 300 miles, right? And so, or 200 miles, 100 miles, the transportation just, the issue trying to get transportation 100 miles away is still not really solving the problem, right? And so that is a very valid criticism. It's going to be better in some areas and not so good in others, but the state is actively working, United Way is actively working on developing and adding new organizations every day. And individually, that's 19,000 resources. So that's still pretty impressive. And that number is higher than it was this time last year. It was around 12,000. So they're making gains just slowly but surely. And if any of you have ever used it and have complaints or issues or feedback, there's also KVH. We're going to be working with the state and drilling down on like some of the areas where we can improve KYnect Resources. So there'll be opportunities. I would love to hear any of that feedback. So this is what here are all of the stakeholders who are involved, state agencies, community partners, CCBS staff, providers, connectors, United Way, all of these folks are sort of working with KYnect resources to help make it a better, easier, helpful resource for residents, for Kentuckians. So you can go to kynect.ky.gov/resources. And here are just some of the topics that are covered. Here are some of the resources that are available. And then this is what the dashboard looks like for a client. I'm sorry, for a connector or for a community partner who's wanting to make a referral. Yes. And then very last, and I promise this is last, just a plug for our KY loop. So we have heard a lot from in our roadshows, we do a lot of work with community professionals. And the thing that we've heard a lot is just how scattered resources are, how hard it is to find them, and like anything how scattered all of the different web pages are. Sometimes those links are broken. You bookmark your favorite link and you find you are doing assistance, you're doing application assistance, and you finally find this one thing that you want, you bookmark it, and then you come back to it 3 months later, that link is broken and it's moved, and then you have to spend another 45 minutes trying to find it. And so what we've done is pull together all of those resources into one spot, and we've cataloged them by topic. And so we have a whole list of resources that are available on that website that we keep up to date. If you go on there and you see anything missing, you can always suggest, I didn't put that screenshot in there, but you can make suggestions and we will post that. We'll post all of those resources as well. We go through periodically, make sure that all the links are still linking and nothing's broken. And then we also have a Facebook page now where we share information like up to date. We send out a weekly Friday email. It goes out 11 a.m. on Fridays. Here are some events that are coming up in the next week. Here are some pending, pressing updates about whatever it might be. We cover all of the topics. And then on the Facebook group, we also share out that information in real time. And there's also that ability in our Facebook group to ask questions anonymously. So if you don't necessarily want your personal name, your personal Facebook page name associated with a question on the page, you can still ask questions anonymously, and we have staff who will answer those questions for you right there. So I'm really excited about that. And then we also have a full list of our explainers, like that SNAP reporting requirements explainer, listed on our posted on our KY loop. So, and here's a list of all of the other ones. We do Medicaid renewal, special enrollment periods, SNAP itself, mental health, family glitch, childcare assistance, and KTAP. So if you need more information about those programs, those one-pager explainers really walk through each of those programs and give you more information about those guidelines. And so with that, I think, oh, yes. Okay, questions. I'm going to stop sharing my screen and open up the chat. Okay. And if anybody has any questions, please feel free to come unmuted. I'm reading through the chat right now. Okay, so outside verifiers like Experian, those are that's genuinely a question Sonia asked in the chat, why I use outside verifiers like Experian. That is a question that we are actively asking folks right now. Right now, it's kind of an industry standard. It is what almost all of the state-based marketplaces are using. It's what healthcare.gov uses, the federal marketplace. And so it's the industry standard right now, but we're starting to see in other states where they're trying to make some moves to move away from credit-based or knowledge-based verifiers. there usually still has to be like some verification process. That's what we're hearing. You still have to verify that the person is who they say they are, because there's this weird belief that people are going to apply for like benefits in other people's names, but we don't see that as, I don't know. We don't ever see that. And it's still in that person's name. So if somebody got applied for Medicaid in my name, and they get a Medicaid card and they go, like, there's still the IRS, there's still the Department of Homeland Security, there's still Social Security Administration. None of the information that they put on the application is going to back up like actual any of the what they would put on the application. So I don't really see it as that much of an issue, but we're working on it. We do think it's problematic for lots of reasons. Yeah. Um, Sonia, I also have heard lots of horrible stories and about getting calling DCBS and getting dropped. One time I called DCBS at 3 o'clock, and at 4:45, it like turned over to the message like, "Oh, this office is now closed," and then just ended the call. And when I tell you, I was so frustrated. I almost threw my phone. Like, I hear all the time from folks about being on calling the call center, waiting for an hour, 2 hours, 3 hours. The worst that I just heard was 2 hours, was a couple weeks ago. They said they were on for 6 hours and no one ever answered. And then the call just dropped. Yeah, it's super problematic. If you have dropped calls frequently, you can always you forward those numbers to me, or I can give you the contact number. The state will investigate that. Like, if we give them the call and the time, they'll actually look at it to see if it was like a system problem or if a like worker answered the phone and hung up, because we also hear that too. Um, Disconnected. Um, it's super. That's the one way for me to just like lose my crap. Just do not. Oh my god. I'm trying again. Or finding which. Yeah, definitely recommend making friends with connectors in your area. Uh, like, they can help with all of this. Um, da-da-da. There is not really a max income for, I mean, there is. So it depends. I'm sorry, Jay Darling, what is the max income for a person if they need help with healthcare? It depends. For Medicaid, it's just going to be 138% of the federal poverty line. Whatever their household size is, that's just going to be the income for that. If they're looking at marketplace coverage, there's not technically a max income, but there are functionally max incomes, because, like, if you can't afford it, then I mean, you're still eligible for it. But if you can't afford it, even with the premium tax credit, then that's not helpful in any way, shape, or form, right? But there's not a max income limit on the marketplace side. The tax credit will peter off, usually around somewhere between 380% and 400% of the federal poverty line, but that also depends on the household size. So where it sort of peters off will depend on if it's a household size of 1 versus 5 versus 8. So um, that's a kind of a hard question. Um,
I want to add some information specifically for AmeriCorps members. Um, their income does not count as a wage because it's not a wage, it's a living allowance. So, Jennifer, if you were running into any issues with your living allowance being counted towards like an income threshold, let me know and I have a letter to provide. explaining that. Um, it's just a really niche
Yeah,
role. Um, I did want to ask though, and I'm more than happy to send those income verification letters anywhere. Jeff, your question about where they weren't able to verify your credit, did you not say, Priscilla, to call a connector to figure that out, or a DCBS
yeah.
office?
Yeah, I would
Oh,
call
okay, I got
DCS or a connector. If you call, I suggest calling a connector because a connector can help a little bit easier, a little bit quicker. But DCBS is ultimately the people who will fix it. The thing, if you have a connector, like the connector can wait on hold for 2 hours. Like they can wait on hold for your client. You don't have to do it. The client doesn't have to do it. And that's one of the even just small perks of connectors. They have backdoor access. They have a separate line that they can call. And when they call that line, even if they have to get transferred to DCBS, they get shunted to the front of the line. Sometimes that's helpful. Sometimes that means I'm only going to wait an hour, but sometimes that means I'm still in line waiting for 2 hours, but that's time that your client doesn't have to spend. And most people don't have 2 hours to spend. They either don't have the time they don't have the minutes on their phone, they don't have the time, they're in the middle of their workday. DCBS is only open during prime work hours, but a connector can help do that.
For people, members that are interested in becoming connectors at their site, yeah, if you wouldn't mind sharing that information with the slides and I can forward it
Yeah,
along, that would be
absolutely.
a valuable, um, yeah, to be able I mean, yeah, we found connectors very valuable just because of that access and understanding. Um, my last question, I'm kind of just curious because last year we had Family Scholar House come and talk to us about their myky.info website. Are those like coordinated? Your all's resources coordinated? Yeah.
There's overlap.
Mhm.
We
Okay.
share we share a lot of similar information. We do share information to share with our respective groups. Um, they also share slightly different information. So both and both and that's all my answer. Oh yeah, that also the thing with DCBS, the people who are on the phones, part of that process there is various levels of like training that DCBS workers have to do. And so there are tier one DCBS workers who are allowed to do like just this much. There are tier two who are allowed to do a little bit more, and tier three who are able to do everything. And the people who answer the phone often tend to be tier one. And so when you go into the office, though, those folks usually happen to be tier two. So they're able to do a lot more. So it is usually easier if you have to do something with DCBS. It's usually easier to go in person, but that's not always possible. We know a lot of offices are still remote, a lot of offices are closed or understaffed. And so you might spend 6 hours in the office or 2 hours on the phone. And it's like, which one feels better? Which I hate to say it that way, but that's also just a reality. It really just depends on where you're at. And again, that's where I encourage folks to at least get to know the connectors in your area because they can usually help shortcut some of that.
Yeah, the last thing I'll add is, yeah, if you all are running into any issues with public benefits, I'm also happy to help. Yeah, figure out what's going on because HHCK is a statewide based organization and like our executive director cares on how things are functioning.
Yeah,
Um,
Katrina's great. She is great.
this was so
Well,
helpful, Priscilla. Like, see, I cannot tell you enough. really.
I'm so glad. Well, if there are any other questions, my email is in there, but please feel free to share that out with folks. Um, if folks have issues or problems that come up, please don't hesitate to reach out to me. I'm happy for these slides to go out, and then I'll also look for the updated. Dang, there was something.
You feel free to share like anything in a wrap-up email and I'll forward it
Great,
with the recording.
man. It's Friday. My brain is just it's ready. It's ready. There was something. I'm gonna go back through my slides and that will jog my memory. But I will share out anything else that comes to mind. And if there are any questions, don't hesitate to reach out to me. Thanks so much for letting me come talk to y'all.
Yeah, thank you so much. And this will be shared with other AmeriCorps members too across the state that are probably too busy to be able to join today, but I know it will be helpful information. Yeah, like as you can see in the chat, not just for their clients, but personally.
Yeah,
It's really helpful. Not usually living on a living allowance, so this is all really, really valuable for us in our communities. And yeah, I will gladly share any resources you would like to get out to these housing service members. But thank you so much for taking the time, really.
of course. Thank you. Happy
Yeah.
Friday. Have a great
Yeah.
weekend.
Happy Friday. And you can head out, Priscilla. I'll probably just stay on if any of y'all have any random questions.